Okay, so the basis of this book is essentially all about the history and today's implementing psychiatric drug use to treat the mentally ill. Whitaker strongly asserts his opinion that there seems to be a direct link between the increase of prescribing medications and the increase of severity and frequency of people being diagnosed with a mental illness. Whitaker argues that the medications may in fact be causing the psychotic symptoms in some patients, and he even argues that those that suffered psychotic symptoms for the first time and do not get medications are less likely to experience psychosis again. If they do, then it is with less intensity and severity. Whitaker cites 3 NIM-funded studies that pointed to the same conclusion in their work, and I quote, "Perhaps 50% of newly diagnosed schizophrenia patients, if treated without antipsychotics, would recover and stay well through lengthy follow-up periods. While the revolving door syndrome stems from the drugs, increasing the likelihood that a person who suffered a psychotic break would become chronically ill." Personally, I would argue against this with my own experience from working in mental health. I work in the emergency department at the hospital, and I perform mental health assessments for patients that come into the emergency department. And oftentimes I see psychotic patients we do have to admit to the mental health unit. The individual may refuse medications and not be provided anything for an extended amount of time while on the mental health unit. A lot of times when this happens, though, we see the patient continue to decompensate, and due to a lack of being able to care for or to make logical decisions, instead they're court-ordered for treatment and medication. Following taking the medications for an amount of time, we see a progress in the patient's mental health. As much as I agree that our society as a whole overdiagnoses and overmedicates, in certain situations, a combination between therapy and medication works the best for the patient. I would argue against Whitaker's thoughts about why there is an increase of diagnosed mental disorders into saying that there may now be more governmental and environmental stressors. There's the pressure to look and be a specific image. Bullying even continues when the child is home through social medias. There's no rest from the onslaught of negativity that is portrayed through the media, as well as the rise of mass shooters. All of these issues could cause an increase in stress and possible mental illness. I did, however, enjoy the detailing of the evolution of psychotropic medications, as many began as sedatives or energizers, which they would give to their patients with mental health concerns. Thorazine, Miltown, and Marsalid, Whitaker defined as magic bullets against diseases, to which prompted Whitaker's hypothesis that prior to treatment, patients diagnosed with psychiatric disorders do not suffer from what doctors regularly describe as a chemical imbalance. However, once began on psychiatric medications, the brain begins to function, and I quote Whitaker, "they function abnormally after that point." It is part of our code of ethics for our clients to have informed consent regarding their care. This being said, if a client asks about their diagnosis, then it is within our code to inform our client of this decision. As social workers, it is important to maintain respect for the client's dignity. According to an article by Alan Barksey titled DSM-5 and the Ethics of Diagnosis, it is important to respect and empower clients. We should be language aware instead of saying things like he is a schizophrenic. Instead, we say that he's diagnosed with or coping with schizophrenia. As a social worker, I would use information to back up why the individual was provided with the diagnosis they had been given, including if they took a test, or example, a depression scale, or have them look at their own behaviors, such as stating like, "You have opened up to me about your difficulties having motivation or getting out of bed in the morning, as well as a perpetual feeling that you do not care about anything. Due to these reasons, I feel that you meet criteria for depression." If necessary, I would cite the traits and characteristics that they match per their diagnosis. I would also be honest and say that yes, a diagnosis has to be made in order to continue with treatment, but that I don't want to focus on the label, but rather what is behind why you're feeling this way and what we can do to make you feel better. The recovery model is based off of the concept that mental illness and their treatments are all a human construct. With that in mind, in reading the social construction of mental illness and its implications for the recovery model, we can see how a lot of emphasis is placed on the language that is implemented, that it is an illness. thus conveying that there's something actually wrong with the individual. The recovery model focuses on empowerment of the clients and of actually encouraging and believing in clients to get better and allow them to reach their goals. According to the slideshow from Diagnostic Process class, the recovery model moves away from the social construct of the mental disorder and instead urges clients to change and strive to reach their fullest potential. I would use this model primarily by respecting my client and acknowledging that whatever criteria they may fit on the DSM, that this does not define them, and there are various different individualized aspects that may be playing a part in their emotions or behaviors. I would ensure that I encourage the client to better themselves and to provide them with local resources that may help, to focus on their personalized strengths rather than on their weaknesses. Ultimately, the recovery model can be used to combat the impact from society placing stigma and discrimination on people who have a mental health label. I found an article written by Michael Friedman that really stuck out to me, citing that 60% of the 450 million people worldwide who suffer from mental health conditions do not receive any form of care. This may be attributed to the stigma of people with mental illnesses being dirty, unintelligent, lazy, or dangerous. This causes social distancing from others and results many times with isolation and could lead to an exacerbation of mental health symptoms. As a social worker, I could stand up for patients, encourage for them to be engaged in local activities. I could work to educate others about mental illness, as well as teaching clients coping strategies to deal with individuals treating them differently. The book itself reminded me of the article that we read for in class, the social construction of the mental illness and its implications for the recovery model, which really hammered home the point that mental illness and their treatments are all created by people. That as social workers, we must keep in mind the push for medicating through big pharma, the persistence in our society of psychiatric hospitalizations, and that the DSM was created just through a group of people that decided to implement it into society. We remember that the DSM is not really like a Bible, and to keep in mind all aspects to the individual to provide individualized therapy and use appropriate language. The book also really influenced me to take a step back and to focus on the individual that needs help rather than their label. The book caused me to remind myself to take all diagnoses kind of with a grain of salt and to work on not judging the person based off of their diagnosis, rather to look deeper. The book really provided me a strong insight into the history and development of psychotropic medications and how they began to be increasingly implemented and normalized in society. The take-home message that I have from my reading and research is to treat clients as people and to focus on allowing them to achieve their goals. The message that I took is to not take too much stock into what we are told, as this can apply to every person. This cannot apply to every person sharing a diagnosis, and that sometimes the medication is unnecessary in order for the individual to recover. With the various accounts of individuals that improved following the discontinuation of their medications caused conflicting emotions of worry and hope in me. Worry about the dangers of terminating medication use cold turkey, and hope that perhaps if institutions push less towards medicating and more towards coping strategies, then perhaps there could be a change for the better. The research through the recovery model helped me to identify how to help a patient to find their own ways to recover and to ultimately meet their own full potential. So that is my takes on the Whitaker book. Thank you.